dear friends and colleagues, Dr. Sundar, Dr. Louis, and Dr. Jian. My talk today, I'm not going to talk about the surgical technique. I'm going to talk about the a tip of the concept and the trick that I use in my practice for apply for my surgery. The first part is I apply to use the application named C Anatomy to my patient. You can download in the App Store or in the Google Play, and the cost is not that expensive. And we can use to do the surgery and use to understanding the anatomy and for confidence. And the second part is the free DICOM outcome that apply for using for more education. And the first one, the application, they have a several application that are available, but one of the most practical and very good is called Complete Anatomy. If you go to the App Store and you go and you open it, download it, and you know it's really not that expensive. For a year, right now it's reduced to be only $99 per year, and you can use a lot. And I do recommend the professional type. And you can use for patient education license, you can presentation license, and you got the synchronous in all device. I mean, if you have many computer, you can open that. So I have used apply to 4 category of the surgery. The first 2 I apply for decompression and orbital fracture, and orbital foreign body removal and optic nerve sheath fenestration. Let's start for the first one. The first one, if you have the open that, you can see the medial wall, and you can try to study about the ethmoid bone in every direction. You can learn about surface anatomy. You can cut and making like inferior wall decompression. You study about inside the anatomy, increasing the confidence. And this one is good. This is the palatine bone, orbital plate, and the body and articulation surface of the palatine bone going to be well understanding for the surgeon, and that allow you to study and learn how intact the palatine bone before you putting the orbital implant. If you have the strong orbital palatine bone, you can see in the cut like axial view and study about the strength and the intact of the palatine bone. So for the lateral wall, you can, if you are the resident fellow, you can try to use application to do the lateral wall decompression, and that one can be very easy. And layer by layer, by the anatomy, you can learn the nerve, the artery, and the vein. That increasing a lot for the confidence of the surgeon. So use the digital work for your presentation, and that help a lot in my practice. When I talk to the orbital floor fracture or orbital wall fracture, I edit the picture by myself and classify like 4 classification. I can show the audience about the orbital stud. I show about the T part, the middle part, front part, and the posterior part. And that represent the understanding of the anatomy. That can represent about the how we're gonna choose the right implant for the patient. If you choose the right implant, the surgical outcome very good. Sometimes the bone is so broken so much. The orbital stud, the orbital ledge, posterior ledge, and the whole of the floor and the medial wall have been broken. So if you put the normal implant, gonna be dropped posteriorly. So that helps us to learn a lot. And the second part about the software called DICOM Viewer. If you go to the Google, you search about the software DICOM Viewer for Mac and Windows for free download. All this one is all free, maybe 25 software for you. I recommend to use the 1 or 2 Horos one and the Ophthalmic one. That's very good for the user of the Macintosh. And when you download it, it's all free, and you can put the CD in your computer and edit. This is a 4 part that I would use. I will share to you. The first one is a 3D rendering and manipulation. If you put the CD in the software, import the data, and they have the one of the function is called rendering. You just put the CT and then you get the very good quality and you can manipulate to see in every direction. That help for understanding. The night before the surgery, we learn about the normal side and the broken side, so we know how to restore the broken bone to be back to normal. And if you want the very, very good quality, I do recommend to use the cut that 0.625 or 1 millimeter. More than that, the quality of the CT scan not so good. Sometimes if you get the not good, when you do the skull model prototype, the quality of the skull model may not so good. And it's very good for the presentation also. For the dimension measurement, one of the mode that used for measuring, you can use how many millimeter of the broken, how many millimeter of the bone that dropped it, and you can bend the implant before the surgery. That in the old day we just go in and cut and put in, put out, put in, put out. But nowadays we do more customized, we do more patient specific implant. The next one, intracorneal metallic foreign body removal. This one has helped me a lot. I use combination between the application and the software. This is certified gentleman got the suffer for the motorized blade injury 2 weeks ago, and he got the scleral wound repair only. But we found that after the PPV, the silicone oil in the eye, but they have the from one of the foreign body intracorneally. This is the wound of this one. You can use the application for teaching your resident, fellow, patient, and create by your own, create the track. And you go inside the eyeball, you go outside the eyeball, and you can put the foreign body intracorneally. Because this area is very difficult to understand if you are the beginner. So if you apply like this, I think it's very helpful. And a couple issues that may be one of the side of the metal. In this case, taught me a lot. When we take a look at the coronal view, initially we can see that the size of the foreign body is about 5 to 3 millimeter. So initially when I do the surgery, I thought, oh, it's going to be very easy because the foreign body is so thick. When we go in, we discover we could not find the foreign body. Retrospectively, I come back to see the scan. I found that the foreign body is not that big, but when you can see from the CT, it's an artifact of the scan from the CT. So three modes that we need to help. The first one is called window level, put in the full dynamic. The second one, color look up table, put in the hot middle. And the third one is opacity, put logarithmic inverse table. In these three modes, you can create and correct the actual size of the foreign body. You can see this is the initial that we can see by the artifact. Because the CT scan, the image come out because of the scattering of the foreign body of the ion. When you put three modes of this one, you can reducing the size of the artifact. And we can see that they have two pieces of the tiny 1 millimeter foreign body. So in this case, I use everything I have. I use the navigator, but when we go in the operation, it's not that easy because every time you put the pressure to the globe, is push the foreign body away, and in this point, the navigator not help. And this is in the application, you can use this one for teaching and learn and teaching and for your presentation also. This is the operation room, and this is the first attempt. The first one, I try to do the transconjunctival approach by infromedial approach. I go behind infromedially. I try to go to intracorneal, but it's not that easy because of the foreign body was lying underneath the lateral rectus. The first attempt, I could not achieve to remove the foreign body. So we tried the second attempt. The second attempt, we have to go transconjunctival and go to subtenon. and go to the and detach the lateral rectus and go underneath the lateral rectus. And with this technique, we can remove the foreign body easily. This is one that helps. If you are the fellow or the resident or the beginner, when you perform the optic nerve sheath fenestration or you have not done this one before, you can try eyelid crease incision or you can try transconjunctival incision. You go to superlow medial and you go underneath the tenon fascia, and you can learn and the understanding about the optic nerve, about the layer and the sheath of the optic nerve. They have the outer layer and the inner layer of the optic nerve sheath. The inner layer, they have combination of the arachnoid, subarachnoid space and the pure matter. So in this app, they taught us a lot and for understanding and for the confidence, and this is really helpful, and they show us a lot of the detail of the artery, the vein and the nerve. So I hope this one will help if you can apply to your practice. So by conclusion, two of the issue may help a lot in your, I hope this one can help you also.